Namaskaram, ladies and gentlemen, welcome. Today we are going to conduct talk show number 2nd. And in that we have one guest, and the guest name looks like DHRUVI Rajesh Bhai Patel from Gujarat, country India. She's having a great information about heart disease. So today we are going to take a look on myocardial infarction. Simply this disease known as heart attack. And definition looks like this: a blockage of blood flow. A blockage of blood flow to the heart muscle. This is known as heart attack. If we talk about in simple definition. Now we are going to understand heart attack by animation. Heart attack usually occurs when a blood clot blocks blood flow to the heart. Simply, you are able to saw an animation. There is a one blood clot which is going to block the heart. Without blood, tissue loses oxygen and dies. Okay, so I'm going to take a look on what are the symptoms of heart attack. So DHRUVI Patel, can you tell me what are the symptoms of heart attack?
The common heart attack signs and symptoms include pressure, tightness, pain, or a squeezing or aching sensation in your chest or arms that may spread to your neck, jaw, or back, heartburn, or abdominal pain. Third one is shortness or breath. It is also include cold sweat, fatigue, and sudden dizziness as well.
Okay, so I got your point. What's your opinion? What are the things, stuffs in our daily life? They are the causes of heart attack.
Heart attack risk factors include age, tobacco, high blood pressure, high blood cholesterol, or triglyceride levels, obesity, diabetes, metabolic syndrome, family history of heart attacks, lack of physical activity, stress, illicit drug use, a history of preeclampsia, and autoimmune condition.
By the way, the causes are too much, I think. So, and recently one actor also died from this heart attack. And the actor name looks like, I think you know the name of that actor. Can you tell me, please?
Siddharth Shukla.
Yeah, definitely. And he is also age of 40 years, and he died from heart attack. And as it is, there are a lot of persons, not only that actor, even some villagers and some poor, rich, all category of the person can die at any moment of time in their life. Only one shock and the game is over. So my next question from you is this: what are the treatments of heart attack?
There are two kinds of treatments. One, you can have medication, and second one is surgical and other procedures. Medication include medications to treat a heart attack might include aspirin, thrombolytics, antiplatelet agents, other blood thinning medications, pain relievers, nitroglycerin, beta blockers, statins as well, and surgical and other procedures. In addition to medication, you might have one of these procedures to treat your heart attack: coronary and angioplasty and stenting. In this procedure, also known as percutaneous coronary intervention (PCI), doctors guide a long thin tube through an artery in your groin or wrist to a blocked artery in your heart. If you have had a heart attack, this procedure is often done immediately after a cardiac catheterization, a procedure used to find blockage. Coronary artery bypass surgery. In some cases, doctors perform emergency bypass surgery at the time of a heart attack. If possible, however, you might have bypass surgery after your heart has had time about 3 to 7 days to recover from your heart attack. Bypass surgery involves sewing veins or arteries in placed in place beyond a blocked or narrowed coronary artery, allowing blood flow to the heart to bypass the narrowed section. That's all.
Okay, so one question coming in my mind, and can you tell me some additional insights about heart attack?
It is very common in India. More than 10 million cases per year coming in this country. Some additional points requires a medical diagnosis, lab tests or imaging often required, treatable by a medical professional, resolves within days to weeks.
Okay.
In critical situations needs emergency care for this disease.
Thank you very much. One thing I want to mention, if you are having angioplasty, okay, I think you know our heart is located here, okay, left side. And if we are having angioplasty, some patients have pain in the shoulder, left shoulder, after completing of angioplasty because of the operation. And that's why I'm going to tell some other ways to treat heart attack, and this is known as Ayurveda. And in that there are so homemade remedies. For example, if you are having like chances of heart attack, one vegetable, and the vegetable name looks like bottle gourd. Okay, so you have to drink the juice of bottle gourd, and in Hindi it's known as Loki, and some area in the North India it's known as kaddu as well. Okay, so you have to drink the juice of bottle gourd with 7 basil, means the leaves of tulsi, and 7 mint leaves. Okay, and if you also have black pepper, then just make a mash of it and drink with bottle gourd juice. As well as there is one remedy as well. If you know one like herb, the herb name is Terminalia arjuna. That is the scientific name and commonly known as Arjun. And in India it's known as Arjun ki chal, the bark of Terminalia arjun. Remember it, Terminalia arjun is the scientific name, and some person also used to say like that, Terminalia arjuna, but real is Arjun only. So just you have to do one thing. You have to take grind the bark of Terminalia arjun, and then just it's in the powder form. Just put or mix into the milk and drink on the daily basis. One time morning, one time evening. Definitely you are not going to have any heart attack. And by the way, DHRUVI Patel told us the method, but this is costly method, okay? And a lot of person in the world, they want free methods. So in that sector, that is the free method. And if you don't want to take any medicine as well, then remember it, if you are having the chance of 80 to 90% of heart attack, then after also if you are doing growth, and in the when talk about internationally, then it's known as yoga nowadays. So there are some yoga, for example Kapalbhati, I think you know, Anulom Vilom, and Brahmari, okay, and one as well, Astrika. You have to these yoga and like 5 to 10 minutes. That's it. On the daily basis, remember it. And one thing as well, there are some factors as already like DHRUVI Patel told us and mentioned as well. Like we are having, you can say, heart attack because of high cholesterol, right? BP, high BP, blood pressure, and sugar means diabetes. And if you are so obese means thick person, okay, and if you are consuming tobacco, then these are some reasons behind our heart attack. So one thing as well, acupuncture in Chinese and acupressure in India it's known as. So it's simply acupressure and acupuncture a little different. Chinese acupressure, when we relate with Vat, Pitta and Kapha, then it's known as Ayurvedic acupressure, okay. So this is the point in our left hand. I'm talking about left hand, remember it. This point here. You have to press this point for 1 minute.
Okay.
That's it. and this point as well. Little finger, this point. 1 minute.
Yeah.
And one main thing, like Dhruv Patel already mentioned, stress is the main cause to humanist disease to human body. Stress. So this is the place or acupuncture point. If you press this, then your stress is going to be low. Okay, and remember one thing: if you are doing any yoga, don't be like too fast. Okay, I'm going to show some yoga as well, and later. So don't like this. Easily do the yoga in an enjoyable manner, not like forcefully and stressful. Like I have to remove my heart attack or blockage in the heart. And one thing as well, if you are going to do allopathic treatment, then you can do surgery, but there is a chance of heart attack again if you are going to consume like any food which is having like a more number of triglyceride or cholesterol or fatty substance, junk food. If you are consuming these types of food, you can again have a heart attack after completing operation as well. Depends on you. You have to maintain some distance from junk food. Simply you can say no to junk food. So these are some points which I already mentioned to you. And that's it. So that's the completion of our talk show number 2. We will meet again. Then until now, Jai Hind, Jai Bharat.
पुनर्दर्शनाय जय महाकाली।